Carrie, thanks so much. Well, now that spring break is here, you know what follows. Yeah, swimsuit season. Does it have you considering having something done? Well, Dr. Bill Johnson of Innovations Medical is here to help answer questions that you might have about breast augmentation. Dr. Bill, you're here just in time for so many viewers. How are you?
Good morning.
When we start thinking about breast augmentation, this is some really good news. You can actually start to guess and work with you to see how much change it would take to get the results that you need.
Yeah, most people like to think of it when they come in and what I need to get a cup size or 2 cup sizes. And one of the things you have to remember if you're going to talk about cup sizes is the larger your chest size changes the cup size. So that someone that is a 32D has the same cup size as a woman that is a 36A. So the larger you are, the more volume it takes to increase the cup size.
Okay, so let's talk about how you brought some props with you today too. So how will someone know what is going to be ideal for them?
Well, it would follow that the larger you are, the more it takes. So if you're going to be, if you're size 32 and you want to go up about a cup size, then you need between 200 and 250 cc's. That's about 6 to 7 ounces in each breast. So that's about the size of a standard coffee cup.
Okay, that helps to see because sometimes when we talk in cc's, we don't know exactly what that is.
Right, so that's about how much it takes in each breast to get a cup size if you're a 32.
Okay.
If you're a 34, it takes about 300, 400 cc's, or roughly 10 to 12 ounces. That's roughly the size of a standard soda can.
Okay.
So that you have that's about the size of a standard soda can. So that's what you would need if you're 34 to go up a cup size in each breast.
Okay.
If you're 36 to 38, now it starts getting quite a bit more. You need 500 to 600 cc's in each breast, and that's about the size of a standard water bottle. This is 500 cc's, or about 17 ounces, and that's what you need in each breast if you're going to go up a cup size. If you're 36 or to 38.
These visuals really help because some people go in and they know they want some changes, but they just get overwhelmed, right? They get overwhelmed by the process. They get overwhelmed about, what's it going to look like afterwards. So there's a lot of cool advancements with breast augmentation. So let's talk about how viewers can get that volume they desire.
Well, of course, anyone can do breast implants, and breast implants are a good choice. They have the advantage of having their own shape, and you can pretty much dial in the volume. You can say, okay, I want this size or that size. Now that needs to be done with discussion. We do fat transfer, and one of the advantages of fat transfer is it has a real natural look and feel. Most women have enough fat that we can get a cup size, frequently even 2 cup sizes, doing fat transfer.
Yeah, and again, fat transfer is that great double whammy. You're removing fat from an area you didn't want it in the first place, and you're putting it where you want more volume, like in a breast augmentation. And there's so many advantages of having fat transfer rather than other augmentation.
Well, one of the big ones is you don't have a foreign body. You don't have a foreign substance in your body.
Right.
And another advantage is, unlike implants, which always form a capsule, fat doesn't form a capsule, so you can't get the problems with capsular contraction because there's no capsule forming around your own fat.
Okay, so let's talk about the whole process when we go in for that consultation. I'm sure a lot of people are overwhelmed and a little bit nervous. How do you walk them through to kind of determine what's going to be the best result for them?
Well, first thing we need to know, obviously, is what's their desire. What are they trying to change?
Do they bring in pictures? Is that helpful?
They frequently bring in pictures, but most of them, when we're talking breast, have at least some idea of what they want.
Okay.
But what we always then have to find out is where do we want to take the fat from, and what's the most important? Is the breast augmentation the most important, or is the area we're trying to harvest to get the fat the most important?
Right, okay.
Or are both of them important? Because we see all three. We see folks that come in that want just the breast, and they don't care where you get the fat. They'll stand up and say, "Doctor, where do you want to take it?"
Okay.
And we have people that really say, no, I really want to get rid of my love handles.
Okay.
But, oh, can I put that in my breast?
Right.
So we have it both ways.
Okay.
And so it's real important when you come in with a consultation that we talk with the patient, find out what their goals are, so that we can then meet their expectations and get them the look they're wanting.
Okay. What specials do you have for GNC viewers?
Well, what we're doing now is if they'll go to Innovations Medical on Facebook and like us, then they can get a special discount there on Facebook.
That's great. great. Okay, so like you on Facebook, you get to have all the insights of what's coming up and exciting for Innovations Medical. And then also you can maybe get some of those discounts too.
Right.
We like that. Dr. Bill, all good information. Thank you so much. Okay, here's the information that you need to know. Log on to innovationsmedical.com or call the Dallas location 214-420-7970 and over in Fort Worth 817-744-7901. And as always, if you have a question for Dr. Bill Johnson, drop him an email at questions@innovationsmedical.com.